my name is Dr. Marc Adajar from XSculpt. I'm one of the hormone specialists here, and I wanted to talk to you about the process of how to get pelleted with us, how the whole pelleting process goes. So it starts out with a consultation. You come see me or one of my partners if you're interested in hormone optimization, if you heard about it, and wanted to see if you were a candidate and how the whole thing works. So you come to see us for a consultation. We examine or we look at your medical history, we look at your symptoms, and we assess to see if we can help you. And we talk to you about like the risks, the benefits, and what to expect from the pellet therapy, or testosterone therapy in general, I should say. Um, After the consultation and you're very comfortable with everything we talked about and all your questions are answered, we draw your blood. The blood test um, consists of obviously checking your testosterone level. We check also human growth hormone levels, your thyroid level, your vitamin levels, as well as a bunch of labs to determine your overall health, such as your kidneys, your liver, your risk for diabetes, etc. It takes about 5 to 7 days to get those labs back. Some of these hormone labs do take longer. And once you get those labs back, once we get those labs back, we contact you with the results, and we give you a full description of what's going on and what all the fancy numbers mean, and we give you a copy of your results if you draw the blood with us, or if you draw it at your own facility or your own laboratory, you send the labs to us and we provide you a report. The consultation and that interpretation is free. There's no commitment for you to work with us, but if anything, just for your own education. If you decide you want to continue treatment with us, we schedule you for the process of starting therapy. We prefer to do pellet therapy. However, if you don't feel comfortable with pellets, we can always look into other options that works best for you. So the pellet process in itself, it's a local procedure that's done here in the office. You lie down on your stomach or on your side, and then we choose a fatty area in your backside, in your upper buttock. The reason being is because the pellets work in the fatty layer of your skin. We clean the area up with some alcohol. We numb it up with some local anesthesia. That part does sting a little bit, but it only lasts for a couple seconds before the whole area goes numb. And we make a 3 mm incision with a little scalpel. And then through that 3 mm incision, we have a special device where we insert the testosterone dose or the pellets into your subcutaneous tissue or the fatty layer of your skin. We calculate your dosage based on your height, your weight, your age, your symptoms. A lot of things go into the dosing calculation. Once that's done, we cover the incision with some special tapes that will fall off after about a week or two, and then we cover that whole thing with a waterproof dressing, which you will take off in about 5 days. The procedure usually takes about 5 minutes. You go home and you go home, like I said, you go home the same day. You can return to your normal activity. However, because you do have a tiny little incision, we don't want you lifting any leg weights or any leg exercises, including cardio, for 5 days. No swimming, no bathtubs for 5 days. And then after 5 days, you take off that overlying plastic dressing, and then you can do whatever you want. The pellets do then sit in the fatty layer of your skin, and then it takes, if it's your first round, it takes about 2 weeks to start building up in your body. And then around 4 weeks, your levels of testosterone are peaked. And then from 4 weeks to about 6 weeks, your body starts making the appropriate changes with an optimal testosterone level. That being said, it's very important that you see us around 4 weeks so we can check your testosterone level, because there may need to be some adjustment. If you're too low on your testosterone, we can give you what we call a boost at no extra charge, where we add 1 or 2 pellets to get you a little bit higher. If you're higher than what our target, then we adjust your dose on your next round to drop it down a little bit. Everybody is a little bit different regarding their daily activities, their ability to metabolize medication, so we need to make sure we fine tune it for you. Um, and then basically from 6 weeks up to 3 months in women, because women require a much lower dose, and then up from 6 weeks to about 6 months in men, um, your body makes the adjustments for the optimal testosterone levels with all the benefits that come with it, which you could look online, or I'll make a separate video on that. Um, and then you want to continue treatment, then you keep getting repelleted every 3 months in women, and then every about 5-6 months in men. Again, a lot of it depends upon your own physiology, your own metabolism, your own lifestyle. For example, marathon runners or intensive trainers require their pellets to be replaced a little bit faster than normal individuals, sometimes as early as 5 months. The reason why is because these pellets, the way they're absorbed is through blood flow. And if you are constantly training, or you're always on the go in intensive exercise, your blood flows so fast during those exercises, it absorbs the testosterone a lot faster. So, it's not unusual for competitive athletes to get their pellets replaced every 4.5 to 5 months. Women, it's usually every 3 months, maybe 2.5, maybe. But yeah, that's something that we have to watch for. A lot of it's listening to your body to see when it's starting to wear off. Many individuals can feel exactly when it's starting to wear off, and they come in and see us. Okay, that's the video. If you have any questions, please call our office. You can email me or one of my partners below, which I'll leave in the description. And we hope to see you soon. Take it easy.